For this video, I'm going to talk about the conversation me and Chris had about athletic trainers and chiropractors working together. First question, he doesn't really see much of an athletic population. There's some that come in there, but the first question I had is, where does really you see the line being drawn between what seems to be my expertise versus your expertise? And it came down to our discussion is basically what each of us know and what we can bring to the table to help the patient together. So it's not necessarily where the line's drawn, it's who can benefit the patient as far as what we need them to be at and what their goals are for recovery. So obviously his expertise is more towards his the McKenzie model of the realignment of the vertebrae and centralizing all radicular pain. And once they're stable, he says, once he believes they're stable enough to begin strengthening or further rehab from that point, then it becomes athletic trainer. Once they're able to function in ADLs, he says, it becomes more your standpoint to build them up as an athlete. And I guess that makes sense and is fair. The second question I had was more specifically, my second question was mainly aimed towards the idea of, since with the new, I believe, bill that's passing in Iowa, how it tries to have some type of medical professional on the sideline. How does he see a chiropractor fitting in that position? And his answer was pretty good. It was more so he knows that he doesn't have the specific training that an athletic trainer would as far as emergency personnel, emergency care and aid, but he definitely has the ability to diagnose and deduce, and I guess, I'm trying to think of the best word for this, 1 second. He has the ability to deduce what could be wrong and prevent any, I guess, emergency situation to happen. Any emergency situation from escalating, I guess. So while it being not his extreme field of play, he could help more so than if there was no one there, and I can respect that, I guess. He doesn't believe it should be him there, but it's better than nothing. My last question really didn't have anything to deal with specifically athletic trainers and chiropractors, but it was more towards how does he deal with athletes that come in? Does he deal with athletes that come in any differently than he deals with a normal patient? Given the fact that they're not trying to return to ADLs, more so competition, wellness. And he said he really doesn't deal with them much differently. It's patient-centered care, meaning that he's going to treat each patient's case individually like he would, but the fact of the matter is, whether an athlete or not doesn't really make much of a difference to him. He's trying to treat a patient and make them better because there's a reason they came to him specifically for what they believe his skill set can help them with. And that kind of just sums up my conversation I had with Chris.